Well, for over 21 years, Elmwood Pharmacy's friendly, knowledgeable staff has helped the community reach their health goals.
And things like medication management, personalized service, and home delivery help make life, well, a little easier.
It does. Welcome Jeff Kilburn of Elmwood Pharmacy. Good to see you, Jeff. Thanks for stopping in.
Thanks.
Welcome.
You're sitting right over there, kind of in the Elmwood neighborhood.
Right.
I guess that's why they call it Elmwood Pharmacy.
Yeah.
But you're right off 52nd and Leavenworth, kind of right behind J. Coco.
Correct. And then Elmwood Tower is to the east of us.
Yeah.
So we're about a half block in off of Leavenworth Street.
Medications. That's one of the things that some people have a hard time keeping track of, especially if they have multiple medications. How do you do that? How do you help patients out with that?
We have a couple different systems that we put in place, but what we're going to talk about today is compliance packing, or we put medications in a multi-dose container like this, and then on this side it has a picture of the capsule or tablet and then how it's supposed to be taken. But how we go about it is we actually go into the person's home now. Yeah. And so one of the three pharmacists that work, myself, Jeff, Crystal, and Stephanie, we'll get a referral, and then we'll go to the person's home and we'll sit down with the individual and gather all their different bottles of medications, ask them how they take them, and then we'll take those medications back to the store, those bottles, and consolidate everything into a med list, and then verify everything with their primary care provider, as well if they see any specialists. And then from there, we formulate a plan if there's any duplications or things where they were taking something in the morning and may be more appropriate to take in the evening, or something they're taking together doesn't play real nice with one another. Like we had an individual about 6 or 8 weeks ago, her thyroid levels were really low, but she was taking them at the same time as one of her multivitamins of calcium, so the absorption wasn't being very well, the medication wasn't being very well absorbed.
Wasn't as effective.
Correct, and she wasn't taking it on an empty stomach, she was taking it with her breakfast. So we moved it to the evening, and the dose, she's actually been able to reduce her dose a little bit. So.
God, when you look at this thing, though, this can be confusing for anybody,
right?
No matter what age, and you have broken down to morning, noon, evening, and bedtime. And for people that are on a number of medications, you can see how this could be confusing if you didn't lay it out for them in this fashion.
And especially if there's, this is actually somebody's medications. I just grabbed it and covered up all the personal health information, but there's some individuals that have multiple similar white tablets. So how do you keep
they look
all
similar,
and how do you keep all those straight? And then especially if your vision is poor, or you have arthritis or fingers are difficult, and then you have to pour it into a bottle, those type of things. And we got involved about 5 or 6 years ago, but we really started ramping it up about a year ago.
Now, is this a good solution for elderly patients with medications?
Correct. And what I view it as too is it allows the loved ones, the sons and daughters, to come visit their mom and dad at the home and not have to be the caregiver.
Right.
They can go and visit their mom and dad and not worry about if they've taken their medications, because they can take a quick glance. Or we've met a lot of individuals where the son or daughter or caregiver is coming in and putting the medications in packs for them once a week, and it becomes a chore for them. So we've eliminated that from that equation, so to speak. And then now they can go and just enjoy their time with their mom or dad and sit there and not have to worry about the medication. We've taken that task away, basically.
It's an incredible service, whole medication management system on this.
Right.
But this isn't the only thing you do. You do a number of things to help.
Right, and then on the other end of the spectrum, so that the individuals, since we're in Elmwood Pharmacy, there's a lot of young families, and so now we offer the ability to flavor medications that may not taste the best for their infant or pediatric.
I love this idea. So tell us about this. You brought a
So
wheel
what we
here.
do is, if there's a particular medication that doesn't taste the best, we can spin the wheel and it'll give us some different flavor options. And then if the child is with the parent, then we can actually give them a sucker, and they can taste the flavor and see if that flavor is good. And then what we do is, when we mix up the medication, we add that flavoring to the medications, and so as a result of that, it tastes a little bit better, it's more palatable, so then the parents have a better chance of having their infant or child take their medications correctly for the full term.
It's not a hard conversation though with the kids. Hey, try this sucker, and let us know if you like this flavor, because we can make your medicine. And we had my son Grayson had a terrible time with ear infections. It seems like we were battling this for the first year or two of his life after he was born, and so getting him to take some of this medication was difficult.
Yeah, this makes it a little easier for the parents.
So for instance, we have penicillin here, and it'll tell you that here's the good ones that go with it. Apple, you've got grape, some, I think, blueberry. Well, this is in Spanish. No wonder why I can't read it.
I
was like,
the English is on the other side.
I was thinking, I think that's supposed to be blueberry, cherry. So yeah, there's some great options. And
We still love you.
Yeah.
thank you. I'm trying, but I wish I would have had this.
What's Roja?
I know. I was thinking
Just trying to change things up on
manzana.
you.
I think Well, thank you.
But it does, because you can't, I mean, the flavor of the actual medication, you can't mix any additional flavor with that because it may not taste good.
Right, and so this allows us to do that. So through the company Flavor RX.
Right.
Yeah.
Now,
Go ahead.
Elmwood has been open for over 21 years now. How
Correct.
long?
We opened in September of 1996.
Very cool.
And you brought a special offer in with you today, and here's a special offer. Just very simple, right? Free medication flavoring for new customers. If you're a new customer, you haven't tried Elmwood Pharmacy in the past, stop in, and you'll flavor that medication for free.
Right.
The website's right there. People know where to find you right off 52nd, right behind Jay Coco's. Give them a call, 402-551-5200. You take individuals from all over the city, but obviously that Elmwood neighborhood is where you have a lot of your
I
patients.
mean, actually, I can walk to work, so I'm part of the community. So
So you know it
Right
well,
there.
live there, yes.
Jeff, thanks a lot
thank
for
you
coming
so
in.
much.
Appreciate it.
Appreciate it.
Yeah, good to see you.